Hi, and welcome back. So we're going to start in on the respiratory system today. All right, and hide me. So in the respiratory system, right, what we're really talking about is how cells are going to be using oxygen and releasing carbon dioxide, right? So therefore, we have to get the oxygen somehow to the cells, and we have to get that carbon dioxide out of our bodies, right? So that's the main job of our respiratory system. So structurally, we have an upper respiratory system and a lower respiratory system. So it's basically the anatomy. And then functionally, we have what's known as the conducting zone and the respiratory zone. Okay, so that'd be more the physiology. And you can see all the main players here up on this top image, as well as in this cadaver image as well. All right, so let's talk anatomy first. So again, we have the idea of this upper respiratory system and lower respiratory system. And really the upper respiratory system is what you're seeing in this image. It's anything basically here in your head, right? So we're talking about the frontal sinus, your nasal concha, which we'll talk about in a little bit, the meatuses. We're talking about the nares, all of this, the opening of the eustachian tube. Back here, the oropharynx, nasopharynx, this laryngopharynx. That's all part of your upper respiratory system. Really, once you get into the trachea and then like into the chest area and then into your lungs, we consider that a lower respiratory system. You've probably have heard the term like an upper respiratory cold, right? So that's basically when you have a head cold, right? That's what they're referring to. Okay, and then functionally, we have the conducting zone. And what that means is these are simply tubes. Okay, so they're literally conducting, just taking air from one area to the other. There's no gas exchange occurring in them. So these are areas like the nose, the pharynx, larynx, trachea, bronchi, bronchioles, terminal bronchioles. And we'll talk about those in a second. But again, there's no gas exchange occurring. Okay? And then the respiratory zone is where the gas exchange actually occurs. So there are bronchioles that are small enough to allow gas exchange to occur. The alveolar ducts are small enough, as well as the alveolar air sacs and the actual alveoli themselves. Okay, so again, conducting zone, just taking the air from, basically outside the body, inside, and then from in, out, no gas exchange. And then respiratory zone, excuse me, where gas exchange actually is occurring. All right, so let's just talk about some of these actual anatomy structures. Right now you're seeing here the external nasal structures. So you're seeing the different cartilage as well as fibrous connective tissue and fat that make up the nose. That's not part of the actual bone part of your nose, right? I think we are all aware of this, that the skin inside the nose is lined with mucous membrane, right? I think it's most obvious when any of us have a cold. Okay? The actual openings, their nostrils, right? The other sciencey name for them are the external nares. Okay, and I just wanted to give you like a little story, I guess. So I have this it's called the myth of the Cyclops. I think you guys all know what a Cyclops is, right? Big giant individual, one eye right in the middle. Well, it's believed that the myth of the Cyclops actually came from these skulls that were found sort of, around that Africa, Asia area. And what this actually is, and it kind of looks like a human, it's very human-like kind of jaw, kind of an odd, like squished head maybe, with this big old space in the middle. It's actually the skull of an elephant, as you're seeing here. So this opening right here is actually the opening to its nose. Okay, that's where the trunk would be coming out in the middle of the animal's head, right? Its eyes are actually on the sides here. So it's believed that because of this unique nares, this unique opening in elephants, that that's where the myth of the Cyclops was born, right? Which is kind of neat. So, anyway, want to know more about Cyclopses, you can talk to me about it in class. All right. Again, some of the internal structures, right? We have the actual turbinates or the nasal concha. So we saw those in 201. Those were those bony projections, right? They're covered by that mucous membrane. And then there's passageways in between them. And those passageways are the nasal meatuses. So you see the one on top is the superior meatus. This would be this passage here. The middle nasal meatus is the one, well, in the middle. And then the bottom one is called the inferior nasal meatus. But please be careful. It's middle. It's in between the two. It's not medial. It's not more toward the midline. Okay, it's the middle one. Okay, same idea for the nasal concha. Let's see. So basically, we also have the opening of the auditory or the eustachian tube. Again, that's going to go into your middle ear. It helps equalize the pressure in your ear. Infections that you might start off somewhere here in the nasal area can always travel up into the ears, right? That's why you have ear, nose, throat specialists. The fauces, I think they have this term in your lab manual. This is probably the best view that you're going to have of it. What you're looking at here is the tongue, so this is your oral cavity, and then the fauces is simply the opening in the very back of your mouth before you actually get to the throat area. So again, that little opening, it's not really that little, but that opening in the back of your mouth, I want you to kind of like back past your teeth, but before you actually get to your throat. All right, let's see, what else? We have palatine tonsil. Oops, let me go back. Sorry, I clicked that too soon. Pharyngeal tonsil up in here, pharyngeal tonsil, palatine tonsil, lingual tonsil, right? So these will be lymphatic tissue that, again, they're circling the area where things may enter into your body that you don't want, some microbes. So maybe you're breathing something in, so then they circle around the nasal area, making sure that, again, anything gets in, you find that very quickly. Or if you happen to, I don't know, chew in your nails or put your fingers in your mouth, excuse me, and there's something on them, again, the lingual tonsils are there to help catch anything before it goes systemic. Okay. Let's move on from there. Okay. Not surprisingly, olfactory epithelium is there for the sense of smell. We talked about that in 201. Pseudostratified ciliated columnar epithelium with goblet cells line the nasal cavity. Right. One of its important jobs is to warm the air, and as well as help moisten the air. I think we all have had the experience. We walk outside, it's pretty cold outside and dry outside, and it kind of hurts our lungs, right, to breathe in cold, dry air. So your job of those nares is, or I'm sorry, the nasal concha is to basically help moisten and warm the air. The mucus is also going to help trap dust particles. If you've ever been out in one of these like dust storms out here, if you come in and you're blowing your nose, you'll blow out a lot of sand and stuff. Okay. The cilia are going to help move mucus toward the pharynx, toward the back of your throat, so you can either swallow that or you spit it out, right? The sinuses are going to open into that nasal cavity. And remember, we have ethmoid sinus, sphenoid sinus, frontal sinus, maxillary sinus, right? They'll help lighten our skull, and they cause your voice to resonate. So basically, that when you've had a sinus infection or a head cold, you sound funny, right? You sound stuffed up. That's because sound actually bounces around in those chambers and it makes your voice what your voice is. So again, when you're stuffed up, it doesn't bounce around quite the same, so you actually do sound different. Okay. So here's just a kind of interesting bit. So those nasal turbinates, those nasal concha, right? So you can see here's the middle, the superior one, and then the inferior nasal concha. Sometimes people either have like an infection or a growth, like a tumor or something growing in there, so they'll have to remove them. It's called a turbinectomy. So here's this top image is a normal nose before turbinectomy, and then in this image here, you'll see that the inferior nasal concha have been removed, right? And then here the middle ones have been removed, and then here the inferior and middle turbinates have been removed. So you get this big old kind of gap now. Okay. Now one of the issues when they do these turbinectomies is, so if you look at image A here, you'll see that this is the flow of air when everything is intact. That's what normal air would look like. So you can see it's nice and smooth. It's called laminar, right? When it's nice and smooth. There's no like ripples or anything like that. you take out that inferior nasal concha, and you'll notice now that the air that would normally flow nice and smoothly through your nose kind of bounces around, right? And same kind of idea here when you take out the middle one as well. A lot of times it's kind of interesting. A lot of times people then will have very dry noses. They'll have a difficulty smelling. They have difficulty tasting things. And it's been a while since I've looked up any new information on this, but they're saying something like 70% of individuals who have turbinectomies, within 7 years of having a turbinectomy, they suffer from a serious depression. And it's kind of interesting. You know, I don't know what that's due to. I don't know if they actually know what that's due to. My guess is that you know, we're still animals, and I don't, and you know, I think we put a lot of stock in our vision and even hearing, not so much on our sense of smell. You know, we kind of like, well, dogs spend a lot of time sniffing, we don't. But I don't think we realize just how important our sense of smell still is to us, and, you know, even subconsciously. So I think, you know, when that gets disrupted, I think it has some psychological effects, some detrimental ones down the line. And I don't know if you guys have ever used a Neti Pot. This individual is clearly very happy about using one. She's got quite the smile on her face. Sometimes, you know, your nasal passages may get dried out, or there's lots of pollen in them. And so people will use a warm, like body temperature, isotonic saline solution, and basically have the water flow in one nostril, basically through the back, and then out the other side, as you're seeing here. The idea being that if you have a lot of pollen or anything, you know, that might be causing discomfort, kind of gets like just flushed out. Right? All right. So let's talk about the pharynx. Right, so in this image here, hopefully you can see the different color codes. You'll see that here's the nasopharynx, the oropharynx, and then in red here, the laryngopharynx. So if I were to kind of circle these, the nasopharynx is right in this area. The oropharynx is basically right behind the mouth. Okay. And you'll see it's circled here, and it's stated, so the nasopharynx exchanges small amounts of air with the auditory tubes to equalize air pressure between the pharynx and the middle ear. The oropharynx and the laryngopharynx, so here's a better view of the laryngopharynx, is just the space down here. These are the common passageways for both food and air, right? So you put food in your mouth, food here, and then food goes down this way, right? At this point, air should hopefully, air and food separate, right? You don't want food going down your trachea. We'll take a look at the larynx in lab, so it's good to go over it right now. So here you're seeing a frontal view. This is a posterior view of the larynx. So the bone that you're seeing here is the hyoid bone. This large cartilage is the thyroid cartilage, and you see here it's the what we call the Adam's apple commonly, right? Both males and females have an Adam's apple. It's just much larger in males than in females. Okay, so everyone has a thyroid cartilage. In between the two, in between the thyroid cartilage and the hyoid cartilage, you have a membrane. It's called the thyrohyoid membrane. Okay. Below the thyroid cartilage, you have another specialized ring of cartilage that's called the cricoid cartilage. And again, you have a membrane between the two. We call that the cricothyroid ligament. Okay, just based on words going from and to. After that, you have simply tracheal cartilage forming these sort of C-shaped rings around the trachea. Here you're seeing the thyroid gland, and on the back, you'll see the 4 pea-sized parathyroid glands. Also on the back view here, you'll notice sort of this, I guess, 2 pointy projections. The large portion of that pointy projection is something called the arytenoid cartilage. Excuse me. And that is going to be what moves your vocal cords. Okay, so the arytenoid cartilage moves and it pulls on the vocal cords. And then you have the corniculate cartilage. It's the tiny little, like, tip, I guess, on top of that. Here's another view of that. So here you can see where the vocal cords are actually attached to that arytenoid cartilage. So vocal cords are here. The false vocal cords or the ventricular folds are above them. All right. All right. So what I'm going to ask you to do is stop the video here and go ahead and take a look at this vocal cord video. It's basically a video. They put an endoscope down an individual's nose and turn on a strobe light so you can actually see how the vocal cords change their shape due to high-pitched sounds, high-pitched voices and low-pitched voices. Okay, so go ahead and take a look at the video and we'll come back from there. Please let me know if you happen to have any questions about the vocal cords and how their position and shape changes and how that affects sound. Let me know in lab or feel free to email me. All right, I'll talk to you guys a bit.